Hello everyone, this is Dr. Veena and you're watching my YouTube channel, Dr. Veena, your homeopath. Well, today's topic which we are going to discuss is about mouth ulcers. Friends, mouth ulcers are very common condition which we see day to day life. There are many types of mouth ulcers and the most commonest form is the aphthous ulcer, which is also called canker sores. So these are just basic sores which we found around the mouth, that is inside the lip area, tongue area, inside the cheek, the upper and lower palates, the roofs and the floor, below the tongue, and these areas, small sores are there which is reddish in color, whitish in color, and some of them, they are very painful, and it causes trouble to these people. Now let's find out the causes of aphthous ulcer. It can be due to ill-fitting dentures. Patients or the person come with ill-fitting dentures, and due to that ulcers are formed. So we need to find out that. It can be due to some emotional stress. It can be loss of sleep. Due to that also ulcers are seen. Vitamin deficiencies, B12, vitamin B12 deficiency, it also causes aphthous ulcers. Now, similarly, there can be reasons like conditions where gastroenteric conditions like Crohn's disease, ulcerative colitis, these ulcers can be seen. Now, we need to differentiate these basic benign aphthous ulcer with other mouth ulcers. Can be due to fungal infections, Candida albicans infections, which is called oral thrush. It can be due to lichen planus. In lichen planus also ulcers, these white patches are there. Lacy white patch will be formed, seen in immunocompromised people. Similarly, it can be more progressive ulcer like leukoplakia or erythroplakia or even malignant ulcer. Normally, leukoplakia, erythroplakia, it is seen in people who smokes and uses tobacco. So these conditions like leukoplakia, whitish patch will be there. In erythroplakia, it is again precancerous and reddish patches will be seen. Reddish kind of ulcers will be seen. And again, malignant ulcers can be there. If these ulcers, in the mouth, it is not healing, it is coming again and again for 1 year, 2 year, it is still there, then we need to find. But again, these are you know these are not common, but yes, we need to think about these causes also. Now friends, let us see homeopathic management. Well, let me tell you friends, homeopathy manages, treat these ulcers very very well. We will be talking about, there are many medicines, but we will be talking about four top medicines for mouth ulcers, aphthous ulcers. Now, let us talk about the first one, that is called Borax vinata. Now, in Borax vinata, it can be given in small kids, aphthous ulcers in small kids, as well as in old ages also, aphthous ulcers in old ages also. There will be soreness, there will be burning, sore pain will be there, and there will be more salivation will be there. It can be dry mouth also. There you can really use this medicine. Now in borax also, one more very important, dental plates. Due to dental plates in old age people, these ulcers are seen. You give borax vinata in high doses, the aphthous ulcers just gone in few days. Similarly, when you eat, spicy food, or very hot drinks again, which causes soreness in these ulcer, borax vinata is the first great remedy which should be in our minds. Now there is one more general symptom in borax, that is dread of downward motion. Well, what does that mean? It means if you ask and take proper case taking, and you ask the lady comes to us and says, doctor, the baby is not drinking, or it's not sucking the milk. Well, at that point we need to inspect, and if aphthous ulcers are seen, you can give borax vinata. And if you take case deeply, and you find that the kid always cries when you keep the kid inside the crib, or the downward motion, that causes, scariness or, the dread, then the medicine is Borax Vinata. Now, second medicine which we are going to discuss is mercurius. In mercurius also, mercurius in high potency, it is really very, very effective in these ulcers. Now, in mercury, very important symptom is there is salivation. If you ask how about the saliva, there is very much salivation and thirst is also present. So the medicine will be mercurius. And if we see the tongue of the patient, tongue of these people, and there is imprints of the teeth, then again the medicine is mercurius. And these ulcers are little more perforating ones, and there will be soreness and everything. All those basic symptoms of ulcers will be present. The edges will be ill defined and more, perforating, more deeper. Then the medicine is mercurius. Now let us talk about third medicine, that is nitric acid. Now, this medicine, nitric acid, again, this is from an acid group, so debility will be there. And secondly, nitric acid, the pain, the patient will say splinter kind of pain. What is splinter kind of pain? The person will say this, there is something pricking inside, something splinter is there. So there, the soreness, he will or she will describe it like that. The medicine is nitric acid. Again, nitric acid give in higher potencies, and especially when the cause, if you see the cause, it is due to emotional stress, due to, the person is taking care of someone, and the one person, that person is not, sleeping properly, sleep deprivation is there, and there is no other causes, nitric acid is the medicine. Now, last, the fourth medicine which we are going to discuss is again a medicine from acid group, that is called muriatic acid. Now, in muriatic acid also, since it is from acid group, so general debility will be there. And secondly, if it is associated with other gastrointestinal conditions like hemorrhoids, diarrhea, or anal fissures, things like that, anal ulcers, there also this medicine is really do wonders. So four medicines, for first and foremost, Borax Vinata, Mercurius, nitric acid, muriatic acid. These four medicines are really very beneficial to these cases. Let me tell you, friends, these medicines should be given in higher potency. It has been seen higher potency, it really worked really wonderful. So 30 ch, 200 ch, 1 m, try these medicines in these potency. It definitely help the patients with Apthous ulcer. Now, saying this, let me conclude. Apthous ulcers are very common in nature, and with proper management, avoiding the irritants, as I said, maybe toothbrush is too strong, maybe, taking too much of salty, hot drinks, these has to be avoided. Vitamin B12 deficiency, again, that has to be taken care of, or emotional stress, on all these, you can really manage it properly. Second thing, you can tell, rinse the mouth with lukewarm water with little salt. It really helps. Having oral hygiene, again, very important. And then I told you about homeopathic medicines, which really are beneficial for Apthous ulcer. Well, saying that, if you liked my video, you think it is informative, please like and subscribe, and yes, hit that bell icon. Till then, goodbye and thank you.